Welcome back to Infection Prevention and Control on Animal Farms. This course is being presented by the Northwest Center for Occupational Health and Safety, the Center for One Health Research, and Harborview Medical Center at the University of Washington. Module 3 will cover occupational hygiene on animal farms. My name is Kate Durand, and Nancy Simcox and I will be your instructors for this module. Upon completion of this module, you will be able to complete a hazard analysis for infectious disease exposures on a farm. You will also be able to describe methods available to assess exposure to infectious pathogens on a farm and describe the hierarchy of controls and task-specific control methods. You will be able to list personal protective equipment available for infection prevention on the farm, and you can add controls for COVID-19 and other infectious diseases to a farm infection prevention and control plan template. You will also be able to identify resources for worker training and education. In Section 1 of this module, we will be discussing hazard assessment on the farm. So now let's think about identifying the hazards on the farm. The scope of occupational hazards on farms comprehensively includes chemical, biological, physical, and ergonomic hazards. Chemical hazards on farms include pesticides, solvents and other products used for equipment maintenance, and animal medications. Physical hazards or safety hazards include wet walking surfaces that can lead to slips and falls, noise, and heavy equipment and machinery. Infectious diseases fall under the category of biological hazards, along with mold, pollen, and other allergens that may be present in the farm environment. Farm supervisors and ranch managers are familiar with many of the safety hazards on farms and how to control them. However, they are generally less knowledgeable about the hazards associated with infectious pathogens. The first step of a hazard assessment for infection prevention and control on the farm is to identify common sources of infection. Some of the most common sources of infection on farms are the animals themselves, aerosols, needles and other sharps, and animal waste. Animals and their saliva, blood, urine, waste, birthing tissue, and other body fluids are important sources of infection, and it is important to track animal health and worker contact with these animals. Already, farms are implementing biosecurity plans to keep animals healthy, but if animals do become sick with a zoonotic disease, there is a hazard not only to the other animals, but to the workers. There are a number of resources, checklists, and other guidance about keeping animals free of disease, and this will be the primary means of preventing disease transmission from animals to workers on a farm. When considering the types of hazards that animals pose to workers, the following questions should be considered. What kind of animals are on the farm? What kind of infections could those animals carry? Have any diseases been reported in the animals? What is the state of the health of the animals? What type of animal disease control is ongoing and feasible? And is there information available from veterinarians, agricultural extensions, etc., to better characterize animal hazards? As we have learned from the COVID-19 pandemic, aerosols can play a key role in the transmission of infectious diseases. Aerosols are particles, such as liquid droplets, like those you see in the photo from a sneeze or a cough, Or they can be dust particles that have been contaminated by infected animal feces, urine, milk, or other body fluids that contain a pathogen. In occupational hygiene, we typically focus on the size of the particles because of the relationship between size and where a particle will be deposited in the respiratory system. Size also determines how long particles stay airborne. But in the case of infectious pathogens, the size of the particles does not necessarily predict the possible health impact. Even large particles that cannot be inhaled can still cause infection when they land on mucous membranes in the eyes, nose, and mouth, and different pathogens will remain viable for different amounts of time in the air and on surfaces. Aerosols made up of droplets of respiratory secretions are generated when either a human or animal coughs, sneezes, vocalizes, or even simply exhales. If the human or animal is sick, their respiratory secretions may contain bacteria or virus particles that may or may not be infectious depending on the pathogen. We now know that aerosols are an important source of the spread of COVID-19. Aerosols made up of droplets of other body fluids, such as blood and amniotic fluid that is aerosolized during birthing, can also contain pathogens and transmit disease. When a farm worker cleans up the bedding using a shovel, rake, or broom, dust and small particles of bedding that are contaminated with urine and feces become aerosolized and can transmit disease. Milk easily becomes aerosolized in milking operations, and when it contains pathogens, it can also be a source for disease transmission. Needle stick and other sharps injuries are hazardous for many reasons, and they are quite common on animal farms. National Pork Board needle stick injury research shows that over 80% of farm workers working on animal farms have accidentally stuck themselves in the previous year. Needle stick injuries often occur when an animal that is being vaccinated or treated suddenly jumps. Needle sticks cause a physical injury to the worker in that they result in a laceration or puncture wound, but the wound also allows for anything that is on the needle to enter the worker's body and make them sick. This may be a chemotherapeutic agent or other chemical, but it also may be an infectious agent. Vaccines that contain live virus have the potential to infect a worker who accidentally injects the vaccine when an animal moves suddenly. A worker can also become infected from a needle stick if the injury occurs after the needle was used on a sick animal. The health effects of needle sticks range from mild skin infections and allergic reactions to deep tissue wounds or the transmission of zoonotic diseases. Pathogens also exist in animal waste. We are familiar with the manure piles on farms. Research tells us that poorly managed animal feces may result in exposure to many pathogens, including Salmonella, E. coli, Cryptosporidium, and others. But we also need to think about, assess, and manage other waste material that workers have contact with, such as animal bedding, soiled straw, waste feed, and animal parts that are likely to be found among waste, like feathers. All of these can contain pathogens. Once we have identified the hazards on a farm, we can then do a hazard assessment, which is a thorough investigation of the work environment to evaluate the hazards that we have identified. This allows us to estimate the level of risk to workers from each hazard and to prioritize the controls we will discuss in Section 2. Typically, there is very little data collected at the farm level about potential exposures of farm workers to pathogens. A One Health approach can help address the challenges of identifying and assessing biological hazards on the farm. There are many different routes of exposure to pathogens on farms, and as Dr. Lynch explained, these routes of exposures include contact, which can be either direct or indirect, airborne, where particles are suspended in the air and can be inhaled, as well as through animal vectors or by injection. Because we can assume that the greater the exposure to a hazard, the greater risk for the worker, one of the easiest ways to estimate the level of risk to workers is to do an exposure assessment. This involves collecting data that give us information about the magnitude of exposure to a given hazard. The data can be collected in a variety of ways. We can make qualitative observations and conduct interviews with workers to learn more about tasks that workers do. Interviews can be done in person or by surveying the workers to collect standard information on the types of tasks they perform and on their perceptions of the degree of hazard. We can observe workers, and by watching how and how frequently they contact animals and carry out procedures that might generate hazardous aerosols or lead to needle stick injuries, we can get a relative sense of how much exposure they have. Also, occupational hygienists do sampling to quantitatively measure worker exposures. This is standard for many airborne chemical contaminants, but a little more complicated when dealing with infectious pathogens. As we mentioned earlier, pathogens that are in the air or on surfaces may or may not be viable or able to cause infection. In this case, sampling to determine how much is in the air is not always a good measure of risk level. In addition, environmental sampling can be used simply to determine whether or not a specific pathogen is present. For example, if you have operations that generate dust, you might want to sample the dust to see if it is contaminated with infectious pathogens. Or, if you have implemented a control to remove a hazardous pathogen, you might sample to make sure that it has been removed. For example, if you are cleaning and disinfecting surfaces, you can collect wipe samples from the surface to check for any remaining pathogens. So how can you do this environmental sampling? The CDC, NIOSH, and other agencies and organizations have published methods and guidelines that you can follow, allowing you to collect samples yourself. But you may also hire an industrial hygienist or environmental consultant to do your sampling for you. Either way, the samples will need to be sent to a laboratory capable of analyzing for pathogens. If you choose to do the sampling yourself, you can get the required supplies and equipment directly from a supplier or from the laboratory that will do your analysis. Another tool that should be used as part of your hazard assessment is a job hazard analysis. A job hazard analysis is a technique that is used to identify the specific jobs or tasks that expose workers to the hazards you have identified and assessed. When conducting a job hazard analysis, we consider exposure levels and the work process itself, as well as any variability in the way different workers complete tasks and how often tasks are performed in assessing the risk level for each job or task. Some of the tasks that need to be examined on an animal farm include handling animals, assisting in the birthing process, drawing blood, cleaning stalls and pens, giving injections of vaccines or medications, disposing of animal waste and burying carcasses, managing wastewater, and cleaning, sanitizing, and disinfecting equipment, surfaces, and other areas on the farm. Let's consider livestock birthing as an example for a job hazard analysis. We know that sheep, cattle, and goats are known to carry pathogens that can be transmitted to workers involved with birthing of animals. The workers are involved in assisting the animals during birthing, and they clean up the birthing materials after the delivery. These are tasks that can lead to exposure to pathogens. In addition, there may be animals not known to have disease who are diagnosed during birthing. We know that zoonotic pathogens may be present in urine, milk, blood, and semen, and there are other animal tissues and fluids that are potentially infectious during birthing, including aborted fetuses, fetal fluids, placentas, and vaginal discharges. When performing your hazard assessment, it is important to identify the hazardous tasks and the routes of exposure, as well as considering vulnerable worker populations, such as pregnant women. There are many tools that you can use for hazard assessment. As many of you know, manufacturers are required to provide us with safety data sheets for chemical products. These can be used by both employers and workers to understand the risks associated with using these products. However, when workers are exposed to infectious pathogens, there is no requirement for safety data sheets because there is no product manufacturer to create them. This problem has been addressed by public health agencies in Canada who have created pathogen safety data sheets, or PSDSs, aimed at promoting safer biosafety practices. The link on this slide will take you to the pathogen safety data sheets. There is also a mobile app that you can download called PSDS FTSS. And here is a list of additional health and safety resources that may be useful in looking at potential infectious disease exposures on farms. You can find these listed in the resources section of the course in Canvas. This concludes Section 1 of Module 3 of Infection Prevention and Control on Farms. Please continue to Section 2 to learn about controlling hazards on the farm.